Good afternoon, everyone. My name is Jonathan McDaniel. I'm a student in Speech Communications 1010 at the College of Southern Maryland. The purpose of my speech is to inform the class on the benefits of daily exercise, whether cardiovascular or strength, and how they both lead to a healthier lifestyle. The daily exercise is an important part of any routine, partly because of the mental health benefits, but also because it's directly responsible for creating a healthy lifestyle. So you might not be able to run a marathon. You might not even be able to run a single mile. But no matter your level of conditioning, the introduction of daily exercise into your routine will not only improve your mental health, but your overall health as well. I will be exploring how exercise reduces depressive symptoms among college students, how it benefits them, and how someone's level of fitness positively impacts other mental illnesses, such as chronic anxiety, in only one 20-minute session. And lastly, I will examine the effects of exercise on stress and long-term depression alleviation when combined with cognitive behavioral therapy, CBT. So how can you know if exercise will improve your mental health? The incidence of depression among college students is increasingly high, significantly impacting their daily lives. It is also the leading cause of self-harm around the world by young people. The first study started with two different types of cardiovascular exercise. When examined to combat depression, the winner was high-intensity interval training. So, in a circuit exercise, an example of full-body high-intensity interval training workout is achieved by measuring one's heart rate over 163 beats per minute in this study, which was important to measure exertion. A sample exercise from this study included 30 minutes total duration, including 5 minutes of a warm-up, 20 minutes of running on a treadmill, and 5 minutes relaxing. The control group was asked to sit quietly in a quiet room for 30 minutes. Findings concluded that various intensities of a single bout of aerobic exercise significantly alleviates depressive symptoms in college students. So now you know exercise for 20 minutes can improve depressive symptoms among college-age students. But how do we know the results aren't temporary? Can exercise help someone overcome daily stress too? HIIT, high-intensity interval training exercise, without therapy contributes to alleviating depression. Given its effectiveness in reducing symptoms, such as in various psychological disorders, exercise should be further explored in stress-induced exhaustion disorder. In patients with depression, it significantly decreases depression symptoms, regardless of exercise intensity. Similarly, for patients with generalized anxiety disorder, GAD, running at a vigorous intensity significantly reduced anxiety and elevated energy compared to quiet rest. In only 5, 10, and 15 minutes of exercise, different participants were able to demonstrate different levels of fitness. The exercise duration was selected to provide enough time for participants to reach a circulatory and metabolic steady state. Even 5 minutes produced a positive result on mood. The exhaustion disorder group had a reduction in fatigue immediately after exercise compared to pre-exercise, and this mood was sustained for 30 minutes later. Now we know that exercise helps combat not only depression, but daily stress and a host of other psychological disorders. Can a combination of CBT, cognitive behavioral therapy, and exercise work together to reduce depression in college-age students? Cognitive behavioral therapy, CBT, helps improve depressive symptoms. According to among depressed individuals, 15 to 25% of patients do not see any reduction in their symptoms from exercise alone. CBT, cognitive behavioral therapy, is shown to be effective in treating depression by itself, but is CBT more effective when combined with exercise? Past research investigated perceptions of physical exercise, cognitive behavioral therapy, and their combination as an empirically supported treatments for depression in an online sample. Exercise has been used in conjunction with cognitive behavioral therapy to help treat depression. Historically, this is a common approach to treatment. CBT focuses on helping patients change their negative, unhelpful thoughts to more adaptive, positive ones. A combined treatment of exercise and CBT approach to depression. In this treatment, patients receive both the immediate and long-term effects of exercise and learn better coping skills to help them recover from their depressive symptoms. In conclusion, exercise at any level for as little as 20 minutes can improve both mental and physical well-being. Thank you.